Hi, my name is Mohammed, and this is anxiety related disorders and CBT. All psychological disorders have some root in an uncomfortable state we've all experienced known as anxiety. However, there's a difference between what's healthy and what's not. A psychological disorder is rarity, distress, or some sort of dysfunctional pattern that impacts the thoughts, feelings, or behaviors of a person so much so that they are not able to live a healthy life based off of societal approval. Anxiety disorders are classified not only based off of the persistent anxiety itself, but how a person responds to it, and that response impacts the person's life. I'd like to explore a disorder that fits within these categorizations, which is called obsessive compulsive disorder. OCD can simply be defined as undesirable, persistent thoughts or obsessions, which sometimes cause compulsions or actions to reduce the anxiety brought on by those thoughts. A person who has this disorder could have many obsessions and compulsions associated with many parts of their lives, which could make it difficult to even get out of bed. A patient from Sunnybrook Hospital explains that he must tap the door handle 5 times before using it, and that if he'd had to do it for any reason, it must not be an even number. He says that this is his biggest fears or obsessions if he doesn't follow a ritual compulsion is that someone will get cancer or die. At his most severe point, he had over 100 daily OCD rituals and could not properly function. Cognitive behavioral therapy combines both the cognitive and behavioral approaches of psychological treatment, so both a change in thought and a change in behavior is required to alleviate any mental illness. Beckian therapy, or cognitive therapy, is the most popular and most researched. This therapy stems from the cognitive model and emphasizes the change of negative internal dialogue into positive, which will theoretically transform into change behavior. Rational emotive behavior therapy, which is also pretty popular, relies on the ABC's model: activating events, A, which are what causes the beliefs, B, or how the person reflects on their behaviors, and finally, the consequences, C, or the result influenced by the beliefs. An example of REBT could be exemplified in a collegiate track athlete. Say you begin your career not competing well, an activating event, and you begin to think that it's because of your genetics, something not under your control. They are unable to compete properly. This could lead you to not being as motivated in practice and having anxiety over your situation in the future it could lead to. A therapist would try to change your beliefs into thinking that a solution is to try harder in practice or to change your diet, which could lead to a positive consequence. The reason why I chose the concepts I've described to you is because they are connected. Anxiety related disorders, specifically OCD, could be managed or reduced by cognitive behavioral therapy, including REBT. Obviously, this will vary from individual to individual based off of a number of factors, including the severity of OCD. However, because there is so much stigma surrounding having a psychological disorder like OCD, REBT can dramatically improve a patient's perception on having OCD through the ABC model.